Speaking of digital dystopia, a new Medicare pilot program is about to launch that will let private companies use AI to review requests for certain medical care and reward companies when they deny claims. This comes from Stateline, and it's a lengthy article, but we'll take you through the important points and the precedent that something like this sets. It says Medicare's new AI experiment sparks alarm among doctors and lawmakers. A new model will test AI prior authorizations in 6 states. Physicians fear more denials and delays for older adults. A Medicare pilot program will allow private companies to use artificial intelligence to review older Americans' requests for certain medical care and will reward the companies when they deny it. In January, the Federal Centers for Medicare and Medicaid Services will launch the Wasteful and Inappropriate Services Reduction, or WISER, model to test AI-powered prior authorizations on certain health services for Medicare patients in 6 states. Those states are Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. The program is scheduled to last through 2031. The program effectively inserts one of private insurance's most unpopular features, prior authorization, into traditional Medicare, the federal health insurance program for people 65 and older and those with certain disabilities. Prior authorization is the process by which patients and doctors must ask health insurers to approve medical procedures or drugs before proceeding. Adults over 65 generally have 2 options for health insurance: traditional Medicare and Medicare Advantage. Both types of Medicare are funded with public dollars, but Medicare Advantage plans are contracted through private insurance companies. Medicare Advantage plans tend to cost less out of pocket, but patients enrolled in them often must seek prior authorization for care. AI-powered prior authorization in Medicare Advantage and private insurance has attracted intense criticism, legislative action by state and federal lawmakers, federal investigations, and class action lawsuits. It's been linked to bad health outcomes. Dozens of states have passed legislation in recent years to regulate the practice. In June, the Trump administration even extracted a pledge from major health insurers to streamline and reduce prior authorization. Quote, Americans shouldn't have to negotiate with their insurer to get the care they need, U.S. Health and Human Services Secretary Robert F. Kennedy Jr. said in a June statement announcing the pledge. Quote, pitting patients and their doctors against massive companies was not good for anyone, end quote. But 4 days later, after the pledge was announced, the administration rolled out the new WISER program, scheduled to take effect in January. It will require prior authorizations only for certain services and prescriptions that the Centers for Medicare and Medicaid Services has identified as particularly vulnerable to fraud, waste, and abuse or inappropriate use. Those services include, among other things, knee arthroscopy for knee osteoarthritis, skin and tissue substitutes, even certain nerve stimulation services, and incontinence control devices. The companies get paid based on how much money they save Medicare by denying approvals for unnecessary or non-covered services, CMS said in a statement unveiling the program. In November, congressional representatives from Ohio, Washington, and other states introduced a bill to repeal the WISER model. It's currently in committee. The Trump administration has publicly admitted prior authorization is harmful, yet it is moving forward with this misguided effort that would make seniors navigate more red tape to get the care that they're entitled to, U.S. Rep. Susan Delbene, a Washington Democrat and co-sponsor of the bill, said in a November statement. Physician and hospital groups in many of the affected states have backed the bill, which would halt the program at least temporarily. Shepherd, whose medical association supports the bill, said that would give CMS time to get more stakeholder input and give physicians more time to prepare for extra administrative requirements. Quote, conventional wisdom would dictate a program of this magnitude that has elicited so much concern from so many corners would at least be delayed while we work through some things, Shepherd said, but there's no indication that they're going to back off this. And the last excerpt we want to show you before we give you our commentary is that CMS announced in November it has selected 6 private tech companies to pilot the AI programs. Some of them are backed by venture capital funds that count larger insurance companies among their key investors. For example, Oklahoma's pilot will be run by UnitedHealth, which is backed by investors that include Blue Venture Fund, the venture capital arm of BlueCross Blue Shield companies, and Optum Ventures, a venture capital firm connected to UnitedHealth Group, the parent company of UnitedHealthcare. Innovator Inc., chosen to run Ohio's program, counts healthcare giant Kaiser Permanente as an investor. Now, why does this story matter? Well, it matters for several reasons. No, healthcare is not only a Democrat talking point. Any functioning society can and does at bare minimum look after their citizens and, more importantly, their senior citizens, people who have worked throughout their life and contributed their taxes to the infrastructure and world we have today. We have working sewage because of the people who went before us. So when a society puts up more barriers to caring for the elderly, that is a sign of a decline in morals, ethics, and many other things. It's also a sign of what future generations will experience. If we're treating the elderly like this now, how bad will it be in 40 years' time for the current upcoming generation? What are they going to do? Give them all MAID when they're done paying taxes? It also matters because venture capital, or should we say vulture capital, is taking over every single industry, whether it be medical, insurance, finance, tech, housing. They own it all, meaning they get to degrade service for profit as much as they see fit once they have a monopoly. And finally, handing the reins of medical decisions of any kind to AI, which still tells us that COVID vaccines are safe and effective, is a literal nightmare. Once we eliminate the human being from decision-making about caring for people, we put ourselves at the mercy of these tech giants who are actually completely anti-human to feed us through AI a general response according to what their ever-growing profit margins require. This story is about more than Medicare and Medicaid. It is about the direction society is heading in, which is anti-human. The machines, the oracles of tomorrow, will tell us what we can and can't do, what we can and can't eat, what vaccines we have to take, and what medical care we're allowed to receive based on whether the machines decided we're allowed to or not today. It's like Skynet, but worse. Because it's real, it's happening now, and nobody in power seems to be pumping the brakes.